Antimicrobial management in treatment of urinary tract infection among rural women. So I'm Dr. Nandini. I'm working as assistant professor in the Department of Obs and Gynae in Nayakamshan Medical College, Karaikal. It's a union territory of Puducherry. So urinary tract infections are affecting 150 million people every year worldwide. Urinary tract infections are categorized as uncomplicated and complicated. Uncomplicated urinary tract infections are typically affect individuals who are otherwise healthy and have no structural or neurological urinary tract abnormalities. These infections are differentiated into lower urinary tract symptoms and upper urinary tract symptoms. Symptomatic UTIs are commonly treated with antibiotic and results in long-term alteration of the normal microbiota of the vagina and the gastrointestinal tract, and in the development of multi-drug resistant organisms are increasing. So that's a need for evaluating this particular study. So this study is aimed to measure the prevalence of the antimicrobial use and describe the antimicrobial classes and the common indications among rural women. This was a retrospective cohort study. It looked at the prevalence survey of antimicrobial use. Is performed between Jan 2021 to July 2021. The patients attended the Department of Obs and Gynae, outpatient and inpatient care of this Nayakamshan Medical College, Karaikal, were recruited for this particular study. And we looked at the results. We showed the demographic and the clinical data includes the following. The mean age of the women in this study is 58 plus or minus 8.7. The mean BMI of the women were 26 and the mean parity of the women is 3. And most of the women above were postmenopausal and their mean menopause age months were about 142 months. The duration of the urinary symptoms in weeks were 2 plus or minus 1. This is what our population distribution. About 65% of the women were postmenopausal age group, about 35% were premenopausal age group. The percentage of the microbial drugs by route of administration, most of the women received their antibiotic in the intravenous route, and most of them received intravenous and oral medication. A majority received their oral medication compared to intravenous, which is 40%. The antibiotic spectrum that we have used, which included in the first 10 top antibiotic spectrum, including penicillin with extended spectrum, nitrofurantoin derivatives, tetracycline, third generation cephalosporin and glycopeptide, and antibiotics of fluoroquinolones and sulfonamides were also included in that. The distribution shows about 30% of them were belong to nitrofurantoin derivatives, and 35% received penicillin with the extended spectrum, and 20% of them received third generation cephalosporin, and followed by the rest of the antibiotic groups. So these are all the common indications and the common organisms that we have treated in this group. The most of the common indication for this urinary tract were symptomatic, which includes the increased frequency of micturition, pain during micturition, and some of them presented with fever with pain abdomen. So 70% of the women were symptomatic and rest of the 30% were asymptomatic. And as a part of a routine workup with the comorbidities or as a part of a pre-operative workup, these people were picked up with a significant urinary tract infection, which is more than 1 lakh colonies, and for that which they have treated with antibiotic in the rest of the 30% of the population. The common organisms that we have treated is most of the women were with the urine culture have grown E. coli as a common organism, which is contributed about 70%, and the rest of the organisms, Klebsiella, 20% of the population, and 2% of them had a Pseudomonas and 4% with yeast and Citrobacter as the rest of the organisms that involved in their urinary tract infection. To summarize, the mean age of the women in the study population was about 58, and 65% of the women were postmenopausal, and 70% of the urine culture had grown E. coli as a common organism, for this urinary tract infection. And the common antibiotic in use in this particular region is commonly a penicillin, nitrofurantoin, and the third generation cephalosporin were the common antibiotic in use. And being a rural setup with the multiple referral patients from a small nursing homes, and it's a treating center and a tertiary care, and we used to receive the patients from various hospitals, and it is essential to establish antibiotic stewardship in a rural setup to have a uniform treatment among this rural population. And that will be the need of this day in a rural population as well. Thank you for the opportunity.